Situated in Accra, Ghana, lies the Sweden-Ghana Medical Center, which covers the full range of cancer specialties and utilizes state-of-the-art equipment and treatment techniques to provide quality radiation treatment. For West African patients, the center eliminates high costs of travel, culture shock, and allows for physical and emotional treatment in an environment that feels like home. This is popular in Africa. Welcome to the Sweden-Ghana Medical Center.
My name is Dr. Clement Edusa. I'm the Medical Director of Sweden-Ghana Medical Center. We deal with the treatment of oncology cases, more of solid tumors than hematological. As the name says, Sweden-Ghana Medical Center, it was essentially the Sweden investors, so investors from Sweden, who brought up the idea of establishing an oncology center, which is the first private center in Ghana. We started seeing the first patients in 2011 and have been active till date. I came in on board in 2014, so this is my third year of practice. Patients we see at Sweden-Ghana are from essentially the West Coast. So we have a lot of patients coming in from Nigeria, Burkina Faso, Ivory Coast, less patients from Togo and Benin, Sierra Leone and Liberia. We've had a few patients, maybe one or two, coming from Congo and Guinea. So essentially, majority are from Nigeria and Burkina Faso. But we do offer services for local patients, and we've got, I don't know if it was mentioned earlier, an agreement with the Teachers Union, NAT and NAGRAD. So for a small contribution every month, they come in and benefit from the full course of treatment, which is actually expensive. The idea was to have it in 3 phases. So the first phase was going to be the oncology center, and then second phase was supposed to be buildings which could house patients, so who could come in and stay. And then third phase was to expand it further. We're currently on the first phase. We hope that with time we could expand, but you know it's been pretty tough economically in the West African area. So we hope we would reach there one day, and that's our dream, of course. The other thing not to forget is we are pushing towards medical tourism. So most of what we see now is patients go outside to India, to South Africa, some go up north to Egypt, Morocco, to get the same treatment that they could actually have with us. We are not so exposed, we are pretty new, so we hope with time, as the name goes out there, we could actually capitalize on those patients who are going beyond the seas of Africa.
Okay, my name is Chris Osamdodu. I'm the Clinical Practice Manager of the Sweden-Ghana Medical Center, and my role is to supervise all clinical activities at the center. Okay, so at SGMC we cover a full range of cancer specialties using state-of-the-art equipment. For instance, we have an MRI. Our MRI is an open type, so you don't have claustrophobic patients having issues with the kind of MRI we have. It's good for all. Everybody can fit in, and it works better. We also have a CT, which has dual purposes. So what the CT does is that it's able to help us do diagnostics. Aside that, we can also use it for setups for radiotherapy treatment. In addition, we have a 3D conformal planning system. Now, what this means is that we are able to conform to the shape of the tumor. So you're able to have adequate radiation or maximum radiation to the tumor and the minimal to surrounding structures. We have the linear accelerator, and the linear accelerator is one of its kind in the West African sub-region. So this linear accelerator helps us to be able to do the treatment itself. So once the treatment has been planned, then the plan of the patient is sent to the LINAC where we can have the treatment. The linear accelerator has special functions which helps us to be able to perform at maximum level. So it has MLCs, multi-leaf collimators. What these MLCs do is that they move in to assume the shape of the tumor. The linear accelerator has lots of energies we can choose from. So unlike elsewhere, for instance, a cobalt, which has one main energy used for both superficial and deep-seated tumors. The linear accelerator has lots of wide range of energies amidst which you can choose any of them based on the site, based on the site you are treating. So if you have a very superficial tumor, you are using a lower energy. If you have a higher a deep-seated tumor, you are using a high energy. We also have a laminar flow. Now, what this laminar flow does is that it helps us to be able to do our chemotherapy drug preparations. We also do chemotherapy here at SGMC. So the laminar flow helps us to be able to prepare our drugs in a safe environment, in that the preparer, the one who is preparing, that is the staff, is protected. The patient which is going to be given to is protected because it's a closed system. And then the people around, because most of the times the patients come in with their families, so they are also protected from any form of exposure. Lastly, we also have a pharmacy here. We have an in-house pharmacy. You know, oncology care is a specialty, so our drugs are kind of special, and you can't just get them outside in a general pharmacy. So we provide them here. Patients come and then they are seen, after which we provide them the drugs from here instead of going out to go and look for where to buy the drugs and all. So basically, that is the workflow here at SGMC.
SGMC was set up by Europeans for Africa. And what their main objective was to ensure that when it comes to treatment of oncology cases, they offer the same service that is offered to people living in Europe and America. So our treatment processes is just the same as what is offered out there, and we ensure we live by those standards. What this means is that we ensure we understand the needs of our people and our ability to treat them perfectly like our race is the core objective of what we do at our center. SGMC is a preferred destination for patients living in West Africa because when you go to India, there are some differences in the race, and that makes treatments quite different, and kind of our traditions are quite different. Language is a barrier, travel is a problem, even the food that we eat. Understanding our main existence is a problem. But SGMC is for Africans and is operated by Africans. We seem to understand ourselves better. We feel more at home when we treat in Ghana. We are also located at a place where travel from West Africa is very easy. At between 45 minutes and 50 minutes from Lagos to Accra, 1 hour and 15 minutes from Abuja to Accra, 45 minutes from Côte d'Ivoire, 1 hour 15 minutes from Burkina Faso, 45 and 40 minutes from Benin and Togo Republic. So it makes it quite easy for us to treat people because we understand them. Now, talking about costs, it's also cheaper comparatively. If you look at traveling from Accra or Nigeria to, let's say, India, it's cheaper. We're talking about fare. When you talk about livelihood, accommodation, I mean, everything, I mean, let's look at it. We are in Africa, so everything that we do is just the same as we have back in our home countries. That's the reason why SGMC is a good destination for treatment of cancer in our part of the world. SGMC is certainly a destination for oncology treatment in West Africa. SGMC has a state-of-the-art equipment, a state-of-the-art treatment facility, and it's for West Africans. We understand our people and we understand their needs. All I would say is, you don't sit down for cancer to eat you up. Anytime you get caught with cancer, turn your face and watch SGMC, and you have a success story. Thank you.